President Trump signed an executive order on August 10th reshaping federal childhood vaccine recommendations from limiting the vaccine schedule to splitting the MMR shot into separate visits. Pediatricians and public health experts are pushing back, with the American Academy of Pediatrics calling the measles, mumps, and rubella recommendation, the MMR recommendation, dangerous. Dr. Didi, emergency physician and leader at Doctors for America, is here to separate facts from fear. Welcome to Care Talk Live, a weekly American healthcare policy show and podcast where we explain how healthcare works or doesn't work and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get future Care Talk shows. Whether you're a parent, a healthcare worker, or an advocate, this is the clear-eyed conversation you need. So welcome to Dr. Didi Ray, a public health innovator working at the intersection of medicine, data, health equity, and public health preparedness. Welcome to the show.
Thank you so much. I'm so glad to be here.
So let's start at the top with how things worked for childhood vaccines prior to a couple weeks ago. What was the standard?
So just one thing, it's actually working the same right now. So one of the things that's important to recall if we go back to the history is that these changes have been attempted a couple times over the last year, notably in January. And in March, a federal judge actually put a hold on all of these changes, saying that basically the people who developed them and the process under which they were developed was not scientifically sound and did not meet the requirements that we usually have for this evidence. But the vaccines basically are if you have young kids, I've got a 3-year-old and a 1.5-year-old, there are a series of, there's a whole bunch of vaccines at different points. Usually we get one at birth, and then 2 for 6 months, and then a year. And then, you're usually maybe a year and a half. And then you, right before the kids go to school, they get another set. And the reason for that many vaccines is because, we are trying to get babies immunized as fast as possible. So we give them shots early so that they are not exposed to illnesses when their immune systems haven't developed. But we want to give them in enough times that your immune system can learn to fight those illnesses, many of them for your whole life.
And in general, vaccines are better than getting the disease in question because obviously there are vaccines for diseases that you don't want, right?
So I've given this analogy before, but it's a little bit of a gross analogy. But let's say your toilet just explodes, right? And you go on YouTube and you figure out how to do it, and you manage to get that toilet fixed, enough to survive the day. So now you kind of know how to do it. So now if it breaks again or you encounter another broken toilet, you kind of know how to do it. But that's very different than someone who has, gone to school, gotten training on how to fix a toilet in a very controlled environment. Maybe they've practiced. And then if they encounter the problem, they know what they're doing and they know how to do it.
Right. And you don't have to deal with the repercussions of an exploding toilet first. So you mentioned that there are vaccines that are recommended at specific ages. In the rollout of this executive order, I believe that statements were made about how kids get hundreds of vaccines when they're young. And that's just not accurate, right?
I think the most you get is 6 at a time. But the reality is, if you're talking about, people like to talk about natural immunity. I call it naturally acquired immunity because vaccines are just having your immune system do what they would normally do. And when we go out and get immunity in the world, the germs that we encounter are not waiting in line one by one for us to encounter them. We encounter them all at one time. And sometimes your immune system works even better when you're doing more than one. Now, with vaccines, we have all kinds of, like sometimes we will tell you not to get 2 live vaccines close together. And that's really like an abundance of caution. We want to make sure that if there is any sort of adverse effect, that we will be able, to identify it, to treat it, to know where it came from. But, getting those shots all at one time is safe and effective. And there is just a copious amount of evidence showing how safe it is. The other thing is that, and I think we talked about this before the show, but like as a mom of young kids, if I had to do a separate appointment for each of those 6 shots, like, I don't know, I probably wouldn't be able to do my job, right? I would not be going on vacations. I would be spending lots of money, and most people, I would be in a really tough spot. I would probably get my kids the vaccines. I have enough flexibility that I can probably go, and if my kids need a vaccine, I can make a sacrifice and do it. Not everybody is in that position. Some people are just not going to be able to get their kids 6 shots.
Mm-hmm. And so stepping back a minute to this executive order, the executive order basically recommended that instead of shots being given together, like MMR, which is measles, mumps, and rubella, as like one shot, recommending separate shots. And so what you're saying is there's no evidence that that is better medically, but it is certainly worse for people with children, for already overwhelmed doctors' offices, for your insurance if you wind up having to pay a copay or anything, take time off, and for your child that is now having 6 doctor's appointments and 6 shots instead of 1, right?
And on top of that, we have measles outbreaks all over the place, right? And so that is an extra, if it's 2 weeks, if it's a month, but that's an extra month where your child is completely unprotected from measles if it's before their first shot, right? And so that measles is a devastating disease. We've already had kids dying of measles in the country, and I mean, I just remember breathing a sigh of relief. Like my daughter turned 1 on December 6th, and then I got her shots December 9th because that was, the first appointment I could get. And I was so happy that I had finally gotten it for her.
Absolutely. Because I think people have maybe forgotten how bad these diseases were because they have not had personal experience because of the effectiveness of vaccines. But unfortunately, now we're having these outbreaks and we're having to relearn the consequences of not being protected. And as you were saying before, just the difficulties of getting time off and getting a doctor's appointment 6 times and getting your child there and helping your child through this multiple times means that many kids will not get the full dose of their vaccines if this is, if all the shots are split up. That's just the reality of how it is. And with more kids not fully protected, we'll see even more outbreaks and more kids getting really sick, right?
Definitely. I mean, I do not want parents to be in the position where they're picking what shots their kids are going to be able to get. And then, they don't know if they're going to be able to get time off of work for the later ones.
Right. So you were saying before, this executive order is not changing anything right now, right? It's more of a recommendation than a law.
So states decide, states have basically all of the power to decide what vaccines kids need to go to school, which is the biggest requirement. And so the executive order encourages states to do something different than they are right now. But it doesn't, and it cannot, as far as I understand, require states to do anything. But what happens is if some states do follow this advice and do change their laws, we're going to get a disparity in how who's protected and who's not. And kids in some states are not going to have the protection. Kids in other states will. Several states, I think it's up to 23 now, but that might have been on Friday, so it might be even more. 23 states have decided to go with, to maintain the existing vaccine schedule, which is endorsed by the American Academy of Pediatrics. And the American Academy of Pediatrics is keeping it on their website and has published it and said, this is the vaccine schedule we support scientifically. New York, where I live, is one of those states.
Mm-hmm. And so can you talk a little bit more about the danger of public policy decisions being made by people using vibes as their scientific method instead of the people actually doing the science and being the doctors?
Yeah, I mean, I will say, so my specialty is in preventive medicine, right? And so I've had a really deep dive into what it takes for one of these recommendations to become a recommendation. And it really has to be a preponderance of evidence, right? If there is a question, there is, I think that, the new vaccine plans or proposed vaccine plans use the phrase shared clinical decision-making a lot. And, shared clinical decision-making is something where, really there's no evidence that it is helpful. And, we're pretty sure it doesn't hurt you. But everything else, everything that has stronger evidence than that has to be, it doesn't hurt you. And it's the benefits far, far outweigh any potential risks. I'll just tell you the story of Hep B. So one of the proposals is that we would remove the birth dose of hepatitis B. And so right now, every kid is given a birth dose of hepatitis B. And the reason for that is that almost every kid who contracts Hep B as an infant will go on to get chronic hepatitis. And many of them, 25% of them, will die of it. And we just don't know which newborns are going to be exposed to Hep B. But that was the policy that we used before 1991, right? If we tested for Hep B, we hoped that we caught every pregnant person at the right time to test them. And we only gave vaccines and other prophylaxis to people who we had identified, to babies who we had identified as at risk. And then, based on the public health evidence, we started, after 1991, we started doing the birth dose. What happened was that 99% of the cases of Hep B that existed before that were prevented. So this is, thousands and thousands of deaths. I think there was, I'm forgetting the exact numbers, but there was even a cost analysis that was done, I think at the end of last year, showing, millions of dollars saved if if lives are not the thing that's interesting to you. And so we know that it works. And we had a real life experiment, because we had policy that was not as good before, and then we had a better policy. And so to walk that back without any new evidence, new technology, or new anything is just a little confusing to me.
Mm-hmm. And finally, people are getting medical information from places that are not their doctors. Many people don't have insurance or are underinsured and just don't see their doctors very often. So people are getting information from social media and from other sources that maybe are not reputable. Can you talk a little bit about why you vaccinated your kids and why you recommend vaccinations, even though there are some people have had side effects from vaccines?
Mm-hmm. So the reason for me is pretty simple, that the side effects that my kids could get from the vaccines are not nearly close to the side effects of the diseases that they could get from the vaccines. And so for me, it's a no-brainer. Like, you can have these bad things potentially happen to you on the vaccine side, and you can have these on the no vaccine side. Right. I don't know. My parents are not from the U.S. and my parents were in the group that got the first smallpox vaccines, and they still have a little scar on their arms. And life is very different with vaccines and without vaccines. And I think because of the field I'm in medicine and because of my background, I have insight into that. And so I think that it's easy to forget how scary a world without vaccines is. We're starting to see it now. But diseases like measles, even though everybody used to get them, have lifelong consequences. We're learning more and more about how they can have, cognitive consequences on kids. Years, decades later, your immune system actually doesn't work as well if you had measles as a kid. And there's just more and more, and that's if you, of course, survive the measles. So I don't know. I spend all of my time and all of my effort and energy and money, honestly, making sure that my kids have the best life that they can and are set up to do the best they can in the world. And so the idea of not doing something so simple and, so safe that would really give them benefits for the rest of their lives, it just seems I could not even imagine it.
Well, thank you very much for joining us today and for demystifying what's coming out of the White House about vaccines.
Thank you so much for having me.
And just a reminder that we have free or low-cost healthcare resources available on our website at healthcarevoices.org/caretalk. So check it out. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. And now our experts will answer your health insurance questions. So welcome to Diane Archer, founder and president of Just Care, and Louise Norris, health insurance and healthcare reform analyst at healthinsurance.org. So starting with Diane, this question is from Equal Shallot on Reddit, who wants to know, with all the talk about the value of AI being used in making informed decisions, is there any consideration by health insurance companies to use AI to determine approval or denying a claim? I can see the potential for insurance companies not wanting to base decisions that may cost them more money and weaken their power to refuse care. So, Diane, talk about AI and Medicare Advantage.
I would love to, Laura. So this is a really hot and timely and important topic because insurers are using AI. And our listener is correct that they do not use AI in any way that would compromise their profits or in any way restrict their ability to deny care. Unfortunately, several investigations have shown that insurers, particularly in Medicare Advantage, can and do use AI all the time to deny care and boost profits. And that is actually a serious concern that is under investigation now by Senators Josh Hawley and Richard Blumenthal in the Senate because of so many denials. What insurers can do with AI is deny coverage to thousands of enrollees in one fell swoop without regard to their individual situations. Enrollees needing costly services like cancer care and rehabilitation services have been found to be especially at risk of getting denied those services inappropriately, having their physicians treating opinions overruled, and then having to struggle to get the care they need. There's also a class action lawsuit going on against United Healthcare at the moment for its inappropriate use of AI. And we'll see how that unfolds. But right now, the judge is asking United Health to turn over its rules for using AI to deny coverage. So it's a big issue. It's a serious concern to any of us, all of us, who need healthcare, particularly costly healthcare, because really the treating physician's opinion should be the opinion that the insurer honors. And that's what happens in traditional Medicare, the public health insurance program, for people over 65 and people with disabilities. But in the corporate health insurance world, and including the Medicare Advantage world, the insurers are finding that they can boost their profits by denying care through AI.
Thank you, Diane. And next question is from Acid Ray, also on Reddit, who says that the United Healthcare's billing department and credentialing department have different lists of doctors. So they keep billing my therapy as out of network, but the United Healthcare says they're sending it in with the wrong code or my therapist is not credentialed. However, I checked with the credentialing department and they say they are credentialed. So Louise, tell us what to do when different parts of your insurance company are disagreeing with themselves.
Right. And the other thing is this could also be a billing error on the part of the therapy office. So you can't really know without talking to someone at each entity to figure out where the error is. So it's possible that the therapy office has been submitting the claim, like, for example, if they submitted it under the group provider identifier number instead of the individual therapist's provider identifier number, that could cause a problem. Since they mentioned that it's being billed as intensive outpatient rather than regular outpatient, that could just be a billing code error. It's also possible that United Healthcare's network data, portal is wrong. So I would start by calling the therapy office and asking them specifically for these claims, what provider name is being submitted and what that provider's national provider ID number is, what CPT codes are being billed, what place of service is being shown. If there's an error in the code for the place of service, that could be messing it up as far as being considered intensive outpatient versus regular outpatient. And then confirming, is it actually being billed as regular outpatient therapy? Once you have all that, and you're going to want to take notes, document all of this, get a reference code number for the call if you can, make notes of who you talk to. Then you're going to want to call United Healthcare and ask specifically for the denial code that they're giving you, and ask what national provider ID number are they seeing in their claims system, and see if it matches what the therapy office told you they're sending in, and then have United Healthcare confirm whether that specific provider's ID number is in network. And sometimes a situation like this can just require multiple back and forths. So you might need to call each of these entities more than once. Just keep track of all the calls you make, who you talk to, get reference numbers, and just keep being the squeaky wheel until something gets sorted out.
Thank you, Louise. And next question from Repulsive ABs. My dad lives in Texas and has Medicare and Medicaid. He is in critical medical condition and receives dialysis and home health services and urgently needs ongoing medical care. But for several years, someone's been using his social security number to work. We recently discovered that someone obtained a Blue Cross policy using my dad's identity through an employer he's never worked for. So Blue Cross Blue Shield of Texas has opened a fraud investigation, but while it's pending, multiple doctors' offices are seeing this Blue Cross policy. And as a result, he's having appointments canceled because they think Blue Cross is involved with his coverage, even though he doesn't have Blue Cross. This is a case of identity theft. So what do you do about identity theft when it comes to health insurance? Louise?
Yeah, so this sounds like a really tough situation, especially since this identity theft has been going on for years. I know you said there's already a fraud investigation opened by Blue Cross Blue Shield of Texas. I would also advise that if you haven't already, report the fraud to HHS. You can contact them at 1-800-HHS-TIPS, HHS tips, and also to Medicare, 1-800-Medicare. And just so they are aware of this fraud and can also be working to address it from their end, since he is on Medicare and Medicaid, that's his real coverage. But the more urgent issue at hand here is how do we get his care? Because obviously that can't wait until the fraud investigation is done, because that might take a while. So I would say contacting his medical providers directly and making sure that they are all aware of what's happening and that they have notes in his file. And you need to contact each provider independently because they might not all share the same records. Make sure they all have notes in the file clarifying that the Blue Cross Blue Shield of Texas policy is not valid. It's under a fraud investigation. It should not be billed. And then also contact Blue Cross Blue Shield of Texas and ask to speak to someone regarding this. Say, you know, I understand this fraud investigation is already going on, but what can you do to help me make sure my dad is getting the care he needs? And it might be that they can write you a letter on their official letterhead that you can then take to his doctor's offices to show that it's not just you saying that this is fraudulent, that they have proof. They might be able to go into their portal where providers access the Blue Cross Blue Shield of Texas service, you know, their accounts, and put a note in there saying this is a fraudulent policy, don't bill this policy. Or they may even be able to suppress that policy altogether in their system so that when providers don't see it. One way or another, somebody at Blue Cross Blue Shield of Texas should be able to help you figure out what to do to make it so that the fact that this fraud investigation is ongoing isn't hampering his access to care. And if you might have to, just like with the last question, you might have to be a squeaky wheel and keep calling, keep going, talking to a supervisor, that sort of thing. But ultimately, his providers should only be billing Medicare and Medicaid, since that's his coverage. I'm not sure if his Medicaid is through a health insurance company, through a managed care system. If it is, and if it's Blue Cross Blue Shield of Texas, then you have to sort that out so the providers know the correct Medicaid managed care plan or Medicare Advantage plan. But again, just like with the last question that we talked about, you're going to want to make notes. You're going to want to write down reference numbers for all these calls, note who you spoke to and what they said, and keep following up until you can make sure he's getting the care he needs. And good luck.
Thank you, Louise. I got one more question for you. This is a question for me. I got a call an hour or so ago. They went to voicemail saying they were from my health insurance company, and their legal department. They had some questions, and this immediately sounded to me like a scam. But if you get an unsolicited call from an insurance company that you have coverage with, how can you tell if it's legit or a scam?
I would say this goes for pretty much any service, whether it's your bank, your credit card, your health insurance company, anything like that. If you didn't initiate and ask them to call you, chances are very unlikely they would call you. And even if they did, you want to assume it's a scam. I would not answer the call or hang up right away if you did answer. And then you call them back. You look at your actual insurance card, call the number on the back of your card so that you know, because that's the other thing, is they can spoof the numbers, the caller ID. Caller ID isn't what it used to be. You can't know for sure that the number that's showing up is actually who's calling you. So I would just not answer the call or hang up as soon as you know who they're saying they are. Then you call back the number that's actually on your card and say, hey, did somebody call me? My guess is they're going to say no. But at least then you know that you're speaking to your actual insurance company and not and it's also kind of a red flag if anybody says, hey, this is our legal department, because legal proceedings are pretty much always, I'm not a lawyer, but my understanding is they pretty much always come in the mail. They will not call you. So
absolutely. It seemed like it was a sort of scam that was designed to get you anxious to answer the phone and to be too panicked to think it through. But
and there will be so many, I mean, scam calls always ramp up as we get into the fall regarding health insurance, because Medicare open enrollment is coming, individual market open enrollment is coming. A lot of employers have their open enrollment in the fall. So while there are scam calls all year round, they do become a lot more common as we get into the fall. So be on guard.
Thank you, Louise. And thank you, everyone, for joining us to learn more about healthcare policy, patients' rights, the fight for a just healthcare system, and answers to your questions on health insurance and healthcare. Be sure to check out more free or low-cost healthcare resources on our website at healthcarevoices.org/caretalk. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more, and be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.